So, hi guys, my name is Dr. Mobola Kukoyi. I am an emergency doctor, meaning I see the sickest of the sickest, stabilize, and resuscitate. I am also the president and founder of the Kukoyi Foundation, which is a non-governmental organization that helps to improve healthcare delivery, especially in resource poor settings, as well as improve education among our youth. So HEI has been a partner of my foundation for the past 4 years. So we're called MKF for short, which stands for the Kukoyi Foundation. And so I mentioned that our two main areas of focus are healthcare and education. And so we wanted to partner. We're originally based in the States. We wanted to partner with reputable organizations that were doing impactful work on ground. And I came across HEI through one of their complete projects on teaching CPR. And so I reached out to the team. I talked to Mr. Pascal. I saw that our goals aligned, and more importantly, they had a reputable track record of doing impactful work in the areas of pre-hospital care in Lagos, Nigeria. So for the past 4 years, we have been partners, and we partner with them in two main areas. The first area is in trauma care for pre-hospital. So as an ER doctor, I see how people come in really sick from, say, car accidents. As many of you know, road traffic accidents are the leading cause of death among young people. And the very first 24 hours in trauma is very important for care. So one of our partnerships with HEI is they have local partnerships with local organizations here. And so they identify indigent patients that need those first 24 hours of care. So our partnership with them funds the first 24 hours of those care. And HEI has done a fantastic job with that. The other area of partnership is improving what they call bystander CPR, meaning when, God forbid, somebody falls, becomes unconscious, becomes unresponsive, how do we save them? And so they go around equipping people with those life-saving skills, which is CPR, to help the heart restart. And so in those two main areas is where our partnership with HEI lies. There's a lot of work that needs to be done, different aspects, but with HEI and MKF, our collaboration really has been in the pre-hospital space, as well as the first 24 hours of trauma care. And I think we can start from somewhere, right? I think if we equip enough people with critical life-saving skills, if somebody is bleeding, how do you stop the bleeding? If somebody is unresponsive, how do you bring them back to life? If somebody breaks a bone, how do you stabilize that before they get to the hospital? I think if you can even just focus on that hospital infrastructure, improve our ambulance services, because we know that the time to intervention, the time to care is very critical. So there's definitely a lot of work to be done in Nigeria in the healthcare space. I'm sure we can all agree on that. And HEI is definitely working to improve our pre-hospital outcomes. Absolutely. So it depends on what kind of accident it is. If it's, are you talking about like a car accident, a road traffic accident, people walking, are they not walking? The first thing is always ensure sin is safe. Any class you take, talk about sin safety. Because if something happens to you, then you can't help other people. So before you go rush into the scene of an accident, make sure things are safe, make sure there's no petrol leaking from the car that's about to explode, right? So when you make sure sin is safe, you look around you, triage. If you see somebody that's bleeding, has a large bleed, you can do things like tie a tourniquet, and those are some of the skills that HEI is teaching: how to tie a tourniquet, how to stabilize a fracture, and then we teach CPR. So to answer your question, that's actually a very broad answer. But since safety and then identifying and then since safety calling for help, somebody help, let somebody call an ambulance service while you're trying to triage and trying to use your skills. But that's a very broad question. But I would encourage everybody to take a class. Contact HEI, tell them your interest. You don't have to be in the healthcare space to learn how to save your life, because God forbid this could be your father, your mother, your brother, your sister. Learn CPR, learn how to stop someone bleeding, learn how to stabilize a fracture, learn how to rescue somebody that's choking. This could be your family member. So it's not something specialized only for doctors, this is for everybody. So here we go. Y, F, I think I already feel the safety is SAFETY. So that's YTEFAS. Yay! So I want to give a shout out to HEI Health Emergency Initiative, Mr. Pascal Achine, Dr. Abigail, Mr. Mayowa, just really for the great work you're doing. You're saving lives, you're impacting generations. I want to encourage you to keep up the good work. Also want to say thank you to the Future Project and continuing to highlight this you're highlighting the problems, you're creating exposure, and you're giving us a platform to share our messages. So thank you.